guys, happy Saturday. It's already like late evening because we've been sleeping in. It's rainy, it's gloomy, but it's not like freezing cold, so that's why I got no coat on. Abe and I are out to do some errands. Supposed to be productive today, but with everything going on, I think once we get home, we're just gonna crash and be bums on the couch. Still haven't put Ava's tree yet because I have to clear stuff in the bedroom because, you know, it's all a little messy. But yeah, overdue to go to Sam's Club and going to Walmart again to pick up some stuff here and there. And that's it. And probably figure out what to eat. Hi guys, not much today. I probably won't upload, but we bought so much stuff. We are not shopping anymore. Officially done. I even got some more Tylenol and ice pack to prepare for my biopsy in 2 weeks. I'm still hella nervous. We got presents, not a lot, for my mom and stepdad, just because it's been a while since I bought gifts. This year is just rough. I think it's just now this, and then like just everything going around in the world. This year is rough. This year is rough. Like it's a learning curve. And then had a moment with my lead. Long story. I don't want to talk about that no more. Well, I do want to talk about it, but it's just, I'm exhausted. Maybe I'll mention about it later. Oh my God. But we end up both crying. It's like a toxic ass relationship. Let me just talk about it now. So yesterday I was just ordering Jimmy John's on my own, but you know, I usually try to do it in private. But I was just like, whatever, because usually everyone else goes to the cafeteria or they have their own lunch. And yesterday I was just like, I'm exhausted. So I was at my desk. We all sit close to each other and I'm ordering, looking at the website. All of a sudden, my other coworker who's in a different department, she's old and she usually stirs the pot and acts dumb that she doesn't realize she does things like that, but she does it all the freaking time. So then she wants some, right? And then she goes, oh, how about this girl, how about this girl, how about this girl, how about this girl. That was one annoying thing. I just wanted to order by myself because it gets overwhelming when like 10 plus people wants to order with you, you know, on my card. Like, we're not besties. So I paid for everybody, but yes, you paid me back, but it's also like almost uncomfortable. You know what I mean? And then all of a sudden my lead walks by and she's like, oh, you guys are ordering? And I'm like, fuck. And then I turned, do you want something? And she walks away and made like a little comment and we all heard it, like, I'm always left out. And I'm like, not again. So I freaking got up, went to the back, and talked to her. Like, it wasn't intentional. Because, again, I was just ordering for myself. And all of a sudden, everybody was swarming me on my desk and the computer. And then, blah, blah, blah. I ended up telling her about my situation. And then she tells me about her mom, that she's dying of lung cancer. And then, I don't know what happened. We just started talking about stuff and got, like, we both balled out. We ended up going into her office. We were standing at her door talking, and then she mentioned to me that management did end up talking to her, and I just said I was like burnout, or we got kind of interrupted. She did apologize to me again, but maybe it was just God's work for me to just clear this air one last time, and for 2024. And I kept saying like, but it just keeps happening and just keep doing it. And then, I don't know. I feel like we haven't really had that, stop, Ava, that conversation. I don't know. Or like yesterday, I was walking to the break room. I said, morning. And then she goes, morning. And I'm like, here we go. It's toxic. And 5 minutes later comes to our seat. Hey, girls, what's up? Like, it's so annoying and everyone knows it. And she knows it by now. But it's like, but I'm glad management did talk to her. I'm sure she felt some other way. I wasn't done talking, but I wanted to say, like, I felt like now, and I told her it's just been really awkward between us, the tension or whatever, and she said she doesn't know how to act anymore. And I'm like, I like Happy, blah, 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 her name, and I get it. She's going through stuff. We're all going through stuff, but it doesn't make it all right for you to be a nasty bitch and make everyone else feels like shit. And it's like over and over for years and years and years. I swear to God, I think it's the first time that someone or me got management involved. I think everyone just brushed it off. So maybe it just hit her in the face and realized that shit, maybe it was meant to happen. Like this year was a year of me. I was talking to my coworker about this. Like I used to just take shit from people and not talk back, not give attitude back, just be quiet and like, cry in the corner. Like I still do, but this time around I gave attitude back. And she was probably the one person that I was so scared to like say stuff back and just let her make me feel like shit whenever she wants. But this time maybe I've had it. And I was afraid of the outcome. But it had to happen. Like I didn't know what else to do. I tell management. I don't know. Talking about this makes me emotional. See all the things I have to deal with sometimes? Like I try to mind my own business. I try to like not get close to people. It's just stupid stuff. Like this is why I hate people. And it's funny, you tell people about what's going on. I don't know why I opened my mouth for about my whole biopsy. There's people that are just kind of like, oh, okay. And there's people I texted. Okay, no response back. Like, don't fucking talk to me. Don't fucking text me. If you never talk to me in months, in years, and whatever, okay? Just don't. If you watch my video, just don't even bother. And then it's the same people, you can always text me. You can always text me. It doesn't work that way. If you don't talk to me for years or months, I'm not going to feel comfortable talking to you and expressing and telling you my whole 6+ month story when you know nothing that's been happening to me. Okay?
Okay.
Yeah. So I think the friends that I stopped texting have not heard, never for once for my kid's birthday, never for once on my birthday or holidays for like maybe 2 years now. Gotcha. Got it. All the money I have spent on people that did not deserve me. A lot of people I have helped over the years, whether it's breakups, family problems, cries, whatever, never deserved me. I gave it my all to people. I have gave my heart, my money, my brain to get shit back in this whole friendships. Isn't that crazy? I'm so angry talking about shit like this. Like, I know I got my own issues. I have a lot of healing. And I don't know if I'm ever going to get healed. Because it's over and over and over again. And then the moment I say shit, the moment I stay quiet, it's a problem with me. I'm the bitter person. I'm the angry bitch. Like, it is peaceful to be by yourself. But at the same time, it sucks. And it's moments like this that I'm going through this. It's just going to get to me because I feel like I'm so alone in this situation. Like, people just say, oh, we're there for you. No. Unless you knock my door or you call me or send me flowers or whatever, or like a card saying that you're thinking of me no matter what, then I'm going to believe you. And there's still people that I really helped a lot at work. And then I don't get that, like, same love back. It's interesting. Even, like, the nicest person that you think is really nice is not really your friend. You gotta watch out for that shit, too. You gotta watch out for that shit. I've done too much for people, and I keep doing it. I don't know why I keep doing it. Because I'm just nice like that, I guess. I think too much about others instead of me. But now I don't know if I'm being a hypochondriac. Like my left arm is like hurting. But I know I have a habit of doing this. But now I can't remember if it was because I do this all the time when I'm sleeping and on my phone and I'm laying. Or because I did too much because of the appointments. Because I had to lift my arm a certain way, at a certain angle. For like the mammogram and the ultrasound. Y'all, I'm really nervous. Like pregnancy pain was painful. I had to have I had a mosquito bite years and years ago, and somehow I hit it. It was on like the side of my belly, and then it got really infected, and I got positive for MRSA. From the mosquito. And so it was just like swollen, bumpy, and inflamed. So I went to the ER. My stepdad took me. So they had to numb me with lidocaine. Oh, that was the painful part, the needle. And then they had to slice me up with a knife, cut it open, and take, the pus out. and then stuffed me with gauze, and it had to stay in there, and I had to pull it out at home in 3 days. So I'm sure it's the same situation, but in your boob, the most painful part is definitely the needle, and I'm nervous.
Huh?
Because people got different stories and stuff. Like, I wish I had someone just go in there and hold my hand, but I don't think that's allowed. But, and crazy me, what's, oh, I'm gonna cry. I want my little baby to be there with me, but she can't because she's young.
But I need to go to school.
I think you're on winter break already, honey.
Oh.
Yeah. I'm crazy. Yeah. It's crazy. Like, I'm sure, God, like, I'm sure nothing's gonna happen. But, like, why now? Gosh. I'm still like, again, if I didn't get a physical and get my life checked, I could be walking around with a freaking hella lymph nodes, God forbid, and not know. But I don't have any symptoms. I don't have any pain or anything. Now I'm just getting paranoid. I can look at my boob. I keep pressing it. I keep imagining all like the different scenarios, what to expect, because I've seen so much. I've heard so much. I've read so much over the years, you know, being in the medical field. But it's like when it's your turn, when you're the patient, it's hell scary. And everyone's been really nice. Like, the office I go to is really nice. It's like downstairs. The receptionist is very nice that I haven't seen in a long time. And I feel I have to prepare questions. Like, I'm one of those people who's kind of like, okay, and I don't know how to ask, like, certain questions. I don't know. I'm crazy. Like, the thought of, I see needles going through my boobs. Because I already hate the needles going inside my roof when I'm having like a dental procedure or whatever. Because when I was younger, it was fine. And the older I get, like, that part, it's like the worst part. Now I just can't deal with it when they do it. But, did I tell you I got bubble tea, boba? So good. Yeah, we weren't very productive today. We just did a lot of shopping. Can't do laundry. Still haven't put Ava's Christmas tree up. Just exhausted. And then I feel like I won't see Ava next week because all the doctor's appointments, because my appointments are way early because I don't want to miss work or affect work. And even if I do, they're okay about it because it is what it is. But it's just like, I can't. That's why I'm doing the biopsy on the day that I'm already off. I requested off like a few months ago because during the holidays, I like to have a break. But, yeah, I bought ice pack. If anyone is watching and have any experience like this, what else do you recommend? I bought some more Tylenol because my other one's always running out. They say to make sure to wear a supportive bra or something like that. Can't just wear like I might as well go commando or wear a sports bra, the cheap one by Hanes that Ava wears now. But I'm sure that bra is to hold the ice pack on my boob. It hurts, gonna be swollen. I'm definitely gonna be bruised. I'm just afraid of the pain after that. Like, if I can't move and I feel disabled, I'm gonna feel like shit. I'm trying to remember when I like was in so much pain, or like when I had really back pain. Sometimes when I pull a muscle, it's excruciating to move or get up, and I don't want to be like that because it's Christmas Day. But yeah, my dumbass decided just doing the 22nd. That's literally a few days for Christmas. But at least I have like a 4-day weekend kinda. Because again, I'm trying not to miss work. I have like a month. Almost a month of vacation. Because I used a lot and I don't know. Anyway, let me stop because I'm being annoying. Good morning, friends. Happy Vlogmas. It's day number 10. The sun is kind of coming out. Yes, it was super gloomy. We slept in hell late. Went out hell late. Got home late. Yeah, I need to get up. I need to start doing laundry and picking things up because mom was a mess. And I need to, like, put things away in the room, clothes and stuff, toys, whatever, so Eva can put her freaking tree. There's, like, stuff all over my carpet here next to my bed. Like, I literally just cleaned last weekend. Like, I'm telling y'all, I'm crazy. And, something I still want to show you guys. Yesterday, we bought stuff for my parents. We also Got stuff to make treat bags for Ava's class. I think there's like 26 kids, I'm not sure, but so I'll have enough. If not, then yeah. So yeah, let's get up. Ava's gonna sleep good, but we'll just do her best. Yeah, I'm still nervous. I forgot to break down last night. I need to stop crying around Ava. It's not healthy. It's not. I don't know. I'm getting really nervous, you guys. I just don't. The older I get, like I can't deal with the thought of like needles going deep in my skin. Blood draws I can handle. Like I'm not afraid of like getting shots, injections. I don't know. But I just feel like your boobie area is like extra sensitive. Like I mentioned, I had a punch biopsy. That sounds scary too. It's literally a tool and it punches and clips a chunk of your skin. And yes, they numb you with lidocaine, but oh god. Okay, all right, let's get up. I'm a hot mess today. Just lots of like anxiety. Like I had like a few panic attacks today because I couldn't find stuff. But anyway, I worked on Ava's timeline. I want to show you. We've been working on it for a few weeks because we needed stuff to print out, and yeah, so it's a timeline thingy from like the past, present, and future. Really cute. I'm so glad that we got the photo printer, and I also have my label maker and A wrote stuff that I told her, right? So I'll show you. Hey guys, it is Monday morning. It is Vlogmas day number 11. Sorry, I just don't have the energy to load. I have an appointment to see the breast surgeon in like an hour. So yeah, I told myself I was gonna like prepare questions to ask and stuff, but at the same time it's like I don't know what to ask because I don't know too much. Like the only question that I would like to ask is like, what is the percentage? Like what I have right now is most likely benign, is common around my age. And then like if it were to be cancer, what is the next step? Remove it? Chemotherapy? What? Yeah. So I'm really nervous. I've been having like breakdowns. Like I lose something, I freak out. Poor Ava has to see me like this. And Ava's like giving me hugs and kisses now. I ain't tell her too much, but I told her stuff here and there because she's all I got. But she makes me feel better. So I'm just gonna chill in the car for a bit, get to work, and then get my stuff ready. I'm thankful all of my doctor's offices is within the hospital. She's actually the next building where my primary doctor is. Just 4th floor, I believe. But yeah, here we go. I'm gonna chill in the car for a bit. Here I am again in the gown. Heading back to work now. She took her time. I really like her, and I actually did a voice recording, so I'm gonna listen back to it. I did ask questions. I asked like as much questions as I could ask. Of course, they couldn't give me a straight answer, but it's not really her fault. But they are gonna test for everything possible. She said it's not like abnormal. My blood are great. The tissues are great. It's just what's causing the lymph nodes to be enlarged. It could be like because I'm fighting some infection that I don't know, and also the fact that I'm in healthcare. But it could be a lot of things. But they're gonna, once they get the tissue, they're going to check of every possible thing that may cause it. The worst thing also, it could be lymphoma. So yeah, show you guys later. Hey guys, been home for like an hour already, just relaxing and just eating leftover food. I'm exhausted. I spent like 20 minutes looking for my remote for one of my fairy lights in her bedroom, and it turns out it was a place that where I left it originally, but for some reason I didn't look there. I looked everywhere else except for there. But yeah, not much to say. I feel stressed, I feel confused, I feel overwhelmed. Work is good, it's just now this situation. But I might upload my doctor's visit. I recorded. So yeah, I don't want to talk too much about it anymore. So tomorrow I have my regular office visit with my primary care doctor, and next week is the biopsy. I'm still nervous. So let me know what you guys think of the conversation I had with my doc. I didn't really prepare myself to like ask what specific questions, because I was going to write down some notes, but at the same time we don't know too much, so I couldn't really ask too many, but I did. It's crazy how I'm in the medical field, but there's a lot of stuff that I don't understand because it's never happened to me. It's so weird when you're on the other end now, like me being the patient. But that doctor was so kind, the best bedside manner I've ever experienced in my whole entire life. Not that I've been seeing doctors many times in my life, but it's just I was really nervous, because usually sometimes when you go seek a specialty, you hear all these stories. They're stuck up, they're pushy, and I'm sure she's dealt with many cancer patients. But yeah, hope you guys are all well. Please keep me in your prayers. There were some good answers, there were comforting answers, but at the same time, again, we don't know. So yeah.
Hello. Hi, are you Brenda? Hello, good morning. I'm Dr. Padilla. This is Dr. Livingston.
Hello there.
He's one of the general surgeons. He's hanging out with me today. Thanks for coming to hang out with me. I know it's exactly what you wanted to do today.
know, right?
Yeah. Don't take it personally. Nobody wants to hang out with me. Where do you work at? I saw your jacket. I have the exact same one.
Cardiology.
Oh, no way. Which office?
Fort Simpson building.
Oh, over here.
Yeah.
Nice. Your earrings are beautiful, by the way.
Yeah.
How long have you worked there?
Just January's gonna be like 9 years.
Oh, okay. Well,
Yeah.
as soon as I thought you were going to tell me 9 months. You just said 9 years. Oh my god, that's awesome. I wonder why we haven't run it. I guess I'm not really hanging out too much in that building, but that's awesome. Do you like it?
It's good.
Good, I hope so. I've been there for 9 years.
Yeah. I know everybody. So.
Yeah, that's important.
Yeah.
Well, thanks for coming. I have a lot of things to say, not in a bad way, but I would say I'm going to kind of go through my spiel if that's okay. But do you have any questions for me before I get into my spiel?
Not yet. I'm just a little nervous, like what to expect.
Fair. Yeah, I
or-
totally get that. Well, first I will start with, I love you for getting your mammogram. Thank you.
Yeah, that's overdue.
Yeah. No, it's not. You're just turned 40. I don't know why overdue. Like, you're like right on it. Like, you were like, the minute you turned 40, you got it done. Like, I'm so proud of you. So no, I really do love you for getting your mammogram. But what's interesting is that they didn't actually find anything in the breast tissue. So they found this like lymph node under your arm on the left side, right? So the most common thing that can happen to lymph nodes underneath the arm are usually from the breast, which is why you have to come hang out with me.
Mm-hmm.
But at the end of the day, it could be nothing. It could be that you just have some sort of, you work in healthcare, God knows what your lymph nodes are doing and how many infections you're trying to fight at one time, right? So I would say I'm not 1,000% convinced that something really bad is happening, but at the end of the day, you shouldn't have lymph nodes on one side that you don't have on another.
Oh.
So I think that at the end of the day, we absolutely have to be like overly cautious and just check the box and prove that it's nothing. Does that make sense?
Yeah.
But again, the most common thing that can happen in lymph nodes is something in the breast that then spreads to the lymph nodes. That's usually how that works. But as we were talking about when we looked at your pictures, they didn't find anything in your breast, and we just looked at them again, and I don't see anything either. So I would say, does it mean that bad things from the breast can't start in the lymph node? It can. As a fancy word, it's called an occult malignancy. Would be like potentially the worst case scenario of a cancer that was in the lymph node that came from the breast, but it didn't show up in the breast. But that's really rare. Although it can happen and it's been documented and studies have been written, that's like not a thing.
Okay.
So I would say your breast looks really good. So my question is, what's really happening in these lymph nodes? Could it just be that it was fighting an infection at this time, like right when you got your mammogram? Remember, that's what lymph nodes do, is they fight infections. They fight them even when you don't feel sick. That's the whole point of them, right? So that you don't get sick. So there's a chance that you could have been fighting something, and your lymph nodes just decided that that's what the day you got your mammogram is the day that they were fighting an infection, and you feel fine.
Yeah, because everybody was coughing, then I started coughing a few months ago, off and on.
Mm-hmm.
And I did have COVID like the third year when it first started.
Oh, yeah, okay.
But I felt like ever since then, like I'm always sick, like
Yeah, you
coughing
always
and
had some
colds
sort
all
of
the time
something,
after
right?
that.
Yeah. So it could be, it definitely, absolutely could be from some sort of reaction. I mean, at the end of the day, and you know this because you work in medicine, that like at the end of the day, the most common thing is usually the most common thing. It's not this weird, but at the end of the day, we'll never just rule out that it's just nothing, right? Like I really need to know what it is, because if it is something that is A, breast related, then I want to know what I got to do, right? B, is that if it's not breast related, or if it's not just your body reacting to something, is it something like a lymphoma, for example? Doesn't mean it is, but and lymphomas are usually on both sides, not just one. So that's why I'm like, what's going on here? It doesn't mean you need any surgery. I just love you for getting your mammogram. It may be nothing, is what I'm getting at. But you should at least be symmetric on both sides, and there's something asymmetric about you right now, and so nobody's just going to let that go. A lot of times you can wait 3 months to see if your lymph nodes will go down. But I would probably tell you, as a young woman, I think, and this isn't to put like my own opinion on you, but I would tell you that I'd rather know today what it is. I don't want to wait 3 months in case something happens. Does that make sense?
Yeah.
In the random chance that you're the rare person that this could be something, I'd really rather know today and not 3 months from now. Does that make sense?
Yeah.
So, the biopsy is actually really straightforward. It is not like surgery. There's no stitches afterwards. They just put steri strips on you. They give you a bunch of numbing medication. You won't feel a single thing. But they will take samples of it. Now, because we're not sure, because things look okay in your breast, and I'm less concerned about a breast issue that this is causing it, they are going to basically run a bunch of tests on it, because we don't know what we're looking at just yet. And that's okay. So what I mean by that, though, is your biopsy normally would take maybe like 2 or 3 days to come back. It may take 3 to 5 days to come back, because they will be checking for things like lymphoma, and that lymphoma test takes longer. So I'll call you as like I find out what that shows, but just know I might call you like 6 times. Okay? Just so that we get it done. I do want to see if I can feel it. I'm not 1,000% sure what it is just yet. I'm less excited about it being something in the breast. Again, not that it can't start in the breast, it's just rare for that to happen. It could just be that you work in healthcare and you're fighting some sort of infection, which would be great, but I don't want to just take that at face value and wait 3 months. I want to know what it is. Okay. Questions about that? One more thing to say. Which kind of, I don't have like a good answer right now. That's like the thing. There's just, as you know, like lymph nodes do a lot of things, so there's a lot of potential things from normal to like abnormal that could be going on. It's just hard to tell what it is until I know. And you are adopted, is that correct?
Yes.
Okay. So most common time to get breast cancer is in your 60s and 70s. Like you weren't even close. So it's another reason why, even if without knowing your family history, it's another reason why I'm like less excited about it being any sort of breast related thing, is just because your mammogram looks great and you have no, like, you're just too young to be getting it. Doesn't mean young women can't get it, but it's still rare. Even though we have social media and people talk about it all the time, it's still actually not that common for young women to get breast cancer. So I would just say that's why I'm kind of curious what this is, because I'm less excited about it as a breast issue. Now, let's say that it is a breast issue and I'm totally wrong, okay? I'm not wrong that often, I don't mean to sound arrogant. But I would say, let's say I'm wrong. Once cancer cells go to your lymph nodes, that's when it has a chance to go to other places. By no means does it mean it's gone to other places, but just know that, like, if we ever have to go down that cancer route, I will absolutely get CAT scans to make sure that there's nothing anywhere else. We'll be very complete with what we do, but at the end of the day, you're going to be just fine. We just got to figure out what the hell's happening. Does that make sense?
Yes.
And family history is important, but it's not that important. Again, the most common, even in the most crazy family histories, still only 3 to, depending on what study you read, 3 to 10% of any breast cancers are due to something genetic. So like even being adopted still doesn't, like, I'm not like, oh, all of a sudden you might have something. Like I'm really less concerned about this being breast related. I either think it's just you're normal because you work in a healthcare field and something's doing something, or something else is happening, but we just got to figure out what it is. But like I said, I'll call you as I get each test back. It's just that your testing is going to take, because there is nothing in your breast, and I'm not that suspicious about a breast thing. I do have to do like the whole gamut of testing and staining, so I'll just be calling you 6 times. Okay. Are you able to feel anything?
No.
Not that you've tried.
I do all the time, but then since then I just never felt any pain or
Good,
like
nothing,
weird
right?
bumps or anything hard.
Okay. I'm probably gonna shove my hand underneath your left underarm just BS, which is probably uncomfortable, but I'm gonna see if I can feel it or not. And then no other issues though, like I know I'm not really worried about breast stuff, but any breast issues, lumps, bumps, skin changes, nipple discharge, anything like that?
No, nothing, never.
Okay, good. I'm gonna have you sit here real quick. Are you okay if I examine you in front of Dr. Wilson? Okay. You're allowed to sit down. I really do love your earrings. They're beautiful. I'm gonna do both sides since I have you here. Hands over your head for me. Are you going right to work after this?
Yep.
That's terrible. No, I'm just
I
kidding.
just left my bags there.
Oh, did you walk down? Yeah. Makes sense. Any biopsies on your breast before? Any
No.
issue? Okay, good. I didn't see any, but I really do love you for getting your mammogram. Thank you. But I'll call you as soon as I know something. The hard part is it's just, in a good way, there's not much with your, take your arm real quick. You relaxed your arm completely. There's not much with in your breast tissue, which is really great. Sorry, I'm shoving. Are you doing okay?
Mm-hmm.
This is like so uncomfortable, I know. I don't feel any actually, which is good. I don't want to feel it. Shove my hand here to make sure. Okay. You feel good. Your breast feels good too. Nothing feels abnormal. I'll call you as soon as I know something. I'm sorry I don't have all the answers today. I was hoping to know more, but lymph just do a lot of things, so I'm not exactly sure what's happening yet. We just gotta figure out. That's why I said that we're gonna do a slew of testing on it.
Mm-hmm.
At the end of the day, it honestly could just be you and you're normal, but we gotta prove it. I don't wanna just leave it as you're normal without doing something. Questions?
So like, so my age with the same like thing on the mammogram. Is it like, what would you say that the percentage that it's like benign?
Good question. I would say, based on your age and your mammogram looking good and no real history of anything, I would say that probably like 70% is nothing. But there's this 30% chance that probably it could be something, especially because it's one side, not the other. Your lymph nodes look totally normal on the other side. Now again, when we fight infections, they really are just kind of one-sided. It doesn't always mean that way, so the odds are that it probably is nothing, but I don't want to take the chance that it's nothing. So.
And then like lymph nodes, it's not a mass. What?
No, right. So good question. So lymph nodes they're kind of like kidneys.
Mm-hmm.
So there's two parts to lymph nodes. Well, I should say three. There's three parts to lymph nodes. One is the outside of the kidney, which is called the cortex.
Mm-hmm.
The inside of the kidney, which is where all the blood vessels come in, called the hilum. And then three is the size. And so you can actually have really big lymph nodes, but the cortex and the hilum look totally normal. And so it's actually a normal lymph node.
Mm-hmm.
Your lymph nodes are not big. They're not huge by any means. But what's interesting is that this cortex, the outside part, is like bulging. And it's occluding or blocking off your hilum. And that's the part what looks abnormal. It's because it's not based on the size, it's just that something is causing the outside cortex of your lymph node to grow. And why is that? Is it because it's reacting to an infection and it should grow to create all those immuno things and all those antibodies that you need? Sure. Or is it growing because tumor cells are invading it? That's the big question. But I'd say your size alone is not what, as I said, three things you have to look at in the lymph node is what does the outside look like, the inside, and the size. Your size is fine, but your outside seems to be growing so much that's now pressing on the inside of it. And so the question is, why is it doing that? But it could be normal. That's how normal lymph nodes work. That's how you create those antibodies. The hard part is we just can't. I mean, you look great also. Most people don't just have like lymphoma like all of a sudden and then just randomly find it without feeling some sort of symptoms, right? No fevers, chills, anything like that. Like, I mean, you said just cough thing after, like cold thing after COVID, but I didn't see that written down anywhere. You had any fevers or chills? Yeah. So I'm not as concerned, but I would say the vast majority are going to be benign. Like I said, about 70% I would say are going to be nothing, but 30% is too high of a chance for me not to like try to figure out what this is. Now, most common type, let's say it's a lymphoma. Most common type of lymphoma actually doesn't require any treatment. They just watch you because again, you look great. It doesn't require any treatment. So there are things that can be happening that you'll continue to live your life and be just fine, even in a quote unquote bad situation. But at the end of the day, like I just gotta prove what it is before we go down any route like that. Other questions? That was a very good question.
Good.
Yeah.
For now.
It's fine. Call me if you think of them. It's just the hard part is you don't know, right? Like lymph nodes can do so many things and it can go down so many routes that like having a lymph node with something in it and nothing in your breast kind of opens up a gamut, which isn't a bad thing, but at the same time, like, it's hard to be specific because I really have no idea. Like, it could be anything. But that's okay. That's why I love you for your mammogram. You're my hero. Thank you for doing that. And you didn't delay anything. I'm proud of you. Thank you for getting your mammogram. But I'll call you as soon as I know what the results are. Like I said, I'll probably call you 6 times because as each one comes back, I'll let you know what it shows. But just FYI. Okay, yeah, just let you know. Sorry, I'm going to be kind of annoying. But at the end of the day, regardless of what it shows, like I said, if you happen to be the rare person where breast cancer started in the lymph nodes but not anywhere else, that's okay. I'm always just check the box and prove that everything's okay. Like, once it goes to your lymph nodes, that it can go to other places, so I would get CAT scans just to prove everything. But even having cancer cells in lymph nodes and breast still is not a death sentence. You're going to be fine. We just have to, like, figure out what it is and how we treat it. Does that make sense? Moral of the story is you look awesome, so it's like we just got to make sure that we keep you looking awesome and figure out what the hell's happening. So, if you think of anything else, though, call me. Call me, my turn, message me, whatever you need. Come down and say hi. But otherwise, I'll call you as soon as I have any results.
Thank you so much.
Yeah,
That was much better, kind of.
Kind of. I know. I don't think it's important to say. I just. Oh, I'm sorry. I usually have more things that are like specific, but I don't really have much specific. Because in a good way, your breast tissue looks totally normal, so that's a good thing. Will you take your time to get dressed, and then I will meet you outside as soon as you are done.
Okay,
All right.
Thank you so much.
Yeah, it was nice to meet you.